Good morning, everyone. Welcome to an episode of Coffee Break with Card, La Hora del Cafecito's new sister show. My name is Lourdes Quinones, and I would like to welcome you to the show. So come on in, sign in the comment section below. We'd love to say hello to you. Okay? Coffee Break with Card is a program dedicated to all those in our community who are living with autism, to their family members, and to all those who support them. So come on in again and sign in. Let us say good morning to you. All right? In today's program, we will be discussing the Baker Act. What is it? Why are individuals with autism at a higher risk of being Baker acted? And what can we do to help them? So join us. We have a lot to do about it, to talk about it. Anyway, let's start out by introducing to you our hostesses for today. As I mentioned before, my name is Lourdes Quinones. I am a CARD consultant assigned to the primary age group. Professionally, I'm a pediatric physical therapist as well as a special education teacher. I'm joined by my colleagues, Jasmine Castellano. Buenos días, Jasmine.
Buenos días, Lourdes. Good morning, everyone. Buenos días, Olivia. Good morning.
Amen. Good morning, Olivia McDonald. Good morning.
Buenos días. Good morning, everyone.
All right. As you know, Jasmine Castellano is an excellent professional in the field of mental health. She is a CARD consultant assigned to the group of young men and women in middle and young adults. And she is a mother of 3, one of whom is diagnosed with autism. So welcome, Jasmine.
Thank you, Lourdes.
Olivia McDonald is an excellent professional in the field of public health. She is a CARD consultant assigned to the primary age group, just like me. And she is the mother of a beautiful baby boy and has a younger brother who is diagnosed with autism. So welcome, Olivia.
Thank you, Lourdes.
But before we get started, we want to review the rules by which we want to adhere during the programming, so we make sure to have a safe environment for all of us. Remember to keep an open mind, maintain a positive attitude, and use respectful language. Okay, so Olivia, before we get started, is there audience members that we want to say hello to or any comments?
Yes, we have a good morning from Heather. It's a good morning, Heather. And as well as the president of our constituency board. and Mary.
Good morning, Mary. Thank you so much for being here today. We appreciate you being and taking time to join us. Hi, Jessica. Thank you. Good morning. Thank you for joining us. All right. So for those of you, again, who are just joining the program, in today's program, we're going to be talking about the Baker Act and what is it and why are autistic individuals at a higher risk of being Baker acted and what can you and your loved ones do to help your loved ones with autism. So join us. We have a lot to talk about. So let's get started. It's a lot of content. So let's get started. Jasmine is going to be answering our questions that we're going to be posing. So my first question to you, Jasmine, is what is the Baker Act?
So Lourdes, the Baker Act is a Florida law which outlines the voluntary and involuntary provision of emergency services and a temporary 72-hour detention for mental health examination in accordance to Florida Statute Chapter 394. I want to explain that, like I said, it's a Florida law. Doesn't mean that this law is a national law. Not all the states has a Baker Act. However, I'm assuming that other states have something similar, So because I have families that come from other states over here, and what do you mean Baker Act? What does that mean? Like they don't know. Okay, so it's here in Florida. So the individual being Baker acted has to meet certain criteria. They must have a mental illness as defined in the 394 statute. Mental illness means an impairment of the mental or emotional process that exercise conscious control of one's actions or of the ability to perceive or understand reality, which impairment substantially interferes with the person's ability to meet the ordinary demands of living. For the purposes of this part, the term does not include a developmental disability as it is defined in Chapter 393, intoxication or conditions manifested only by antisocial behavior or substance abuse. There are two additional criteria, and the individual must meet one or both of these circumstances. The first is that due to the mental illness, there is a high chance that they will either cause serious bodily harm to themselves and or others. The second circumstance is that due to the mental illness, they are likely to suffer from neglect or refuse to care themselves, and that neglect refusal will likely cause significant harm to their well-being, which cannot be avoided due to other services or the help of family or friends. Obviously, this law is not intended to help people in very serious situations and as last resort.
Yeah, and I think an important point that you clarified when we were doing the Spanish show is that, this detention it's not, like due to criminal actions. It's not like being arrested. This is it's really for the safety of themselves or others primarily.
Correct.
So why are autistic individuals more likely to experience being Baker acted?
So, as I already mentioned, the law specifically outlines that individuals cannot be Baker acted just because they're having a developmental disability. However, people with autism are more likely to experience mental health issues such as depression and anxiety when it's compared with their neurotypical peers. Also, sometimes things are not black and white, and we're going to share a chart that lists a number of different behaviors. You can see that there is an overlap sometimes between a behavior that is not unusual for someone with autism, and it is also not unusual for those experiencing a mental health condition. So it's very hard sometimes to have that line. There's a fine line, between it is because of autism, it is because of, the mental health condition that the person has, or just because it's part of their normal developmental process. In some cases, a determination needs to be made if this behavior or these behaviors are due to autism or mental health struggles, or sometimes they're both. That is something that clearly requires training and experience to do, and unfortunately, many health providers and law enforcement officers do not have either enough training or experience for these more complicated cases. This sometimes leads to people with autism to be Baker acted when maybe an alternative action would have been more appropriate. And it's important to say that not because there's professionals in the mental health field or doctors or nurses means that they are very well trained in regards to the autism or dealing with people with autism.
You're muted, Lourdes.
I'm having a hard time remembering to unmute myself today. Oh my God. So I was saying, how does somebody becomes Baker acted, and what happens after the process starts?
Yeah, Lourdes, if it is an involuntary admission, it can start in three ways. This information that we're going to share now was taken from the website for the Florida courts. So, for example, any person may sign an affidavit that outlines why a person meets the criteria for an involuntary examination. A circuit judge then decides whether the affidavit adequately documents all the legislatively mandated criteria. If so, the judge enters an ex parte order for involuntary examination directing a law enforcement officer to take the person into custody and deliver the person to the nearest or local hospital or crisis unit, also known as a receiving facility. When we're talking about a hospital and the person is taken to a hospital, doesn't mean that the person is going to go to, a general hospital. There, some hospital, not all of the hospitals, some hospitals, they have a section, a department, a unit for mental health, and that's where the person who is a Baker Act is going to be at. And of course, the process to go in there is to visit is totally completely different than visiting the general hospital. A law enforcement officer encounters someone who meets the criteria and takes that person to the nearest receiving facility. A doctor or other specified healthcare provider decides that a person meets the criteria for an involuntary examination, and a law enforcement officer takes the person into custody and delivers the person to the nearest receiving facility. If somebody is voluntarily trying to Baker Act themselves, they'll sometimes go to see a doctor or go to the emergency room. However, that physician still needs to make the determination that they meet criteria, and they'll be the one who also will determining if it is a voluntary or involuntary admission. Once the individual has been admitted, that person will be there for 72-hour period. Within that 72-hour period of involuntary examination, one of the following 4 actions must be taken based on the individual needs of the person being detained. For example, the person may be released. The person may be released for outpatient treatment. The person may voluntarily agree to further inpatient treatment, or the receiving facility may petition for involuntary placement. If a petition is filed, a hearing must be held within 5 days. So those 4 results or outcomes will happen within those 72 hours.
Thank you for clarifying that, Yasmin. What are some common misconceptions people have about the Baker Act?
So there are many misconceptions about people have, about the Baker Act. For example, people have been surrounding accessing mental health support and the Baker Act. Some of the common ones are that getting Baker Acted automatically means that an individual will receive medication or that an individual can live before the 72-hour period. That is incorrect. Not because you get Baker Acted means that you are going to get medicated. Okay? And that's the same thing. You won't be able to live before the 72-hour period. The only exception is if an adult is a voluntary Baker Act and the care team can confirm that they are no longer having suicidal or homicidal thoughts, and there is outside support. Parents cannot see their child during that 72-hour period. So that's another misconception. As a parent, you have the right to visit your child. They're very strict, let me say. Like I said, these units are not like the general hospital. They're there, but they're separate. They have their own rules, visiting hours. They're very strict. Um, so yeah, but it doesn't mean that you cannot see your child. Sometimes people are confused about what a voluntary Baker Act means. They think that if they go into the hospital, that they can get a prescription for medications and leave, or that they'll be able to meet with licensed therapists and get crisis therapy in the emergency room, and that is incorrect. Uh, Even if a family understand that the fact that there is a 72-hour hold and wants to Baker Act their child, if they don't meet the criteria, they cannot be admitted. Okay. Um, there is also the possibility that someone comes in with law enforcement or professional Baker Act, and the physician review the case will determine that the person does not meet criteria for Baker Act, and they will be discharged back home. There is also confusion of what can happen during the 72 hours period. The individual will likely have to share a room with someone. There are group, and which most likely that's going to happen. There's group sessions and activities, but they are not going to receive like therapies like ABA. So Baker Act is not, where the child is going to get ABA therapy, okay? And they are expected to participate in group sessions and in therapy. They will likely be surrounded by individuals that are not well regulated, and it can also be very overwhelming from a sensory point of view. It can be very traumatizing experience for anyone, absolutely anyone, but especially for somebody with autism. Baker Act that also doesn't have the guarantee of longer term care. Like we said, it's a 72-hour period, so that is not it's not a residential treatment facility where they can stay for a long period of time. Um, and the reason why it can be traumatic, because think about it, our kids with autism, it's a big change out of the blue moon. They are in this place with new people, new professionals telling them what to do, when to do it, how to do it. Other people, other patients in there that are displaying different type of behaviors. You are sleeping on a strange room, on a strange bed with a stranger. It's a total new routine. It's not the routine that you are used to be, and it can be a little, not a little. It can be traumatizing for anyone, but definitely. The fact that there's so many changes for someone with autism. I mean, the lights, the noise, the amount of people, it's a lot for them.
We can't hear you, Lourdes.
I have 3 screens, so by the time I can figure out where the mouse is kind of hard. Anyway, so this is some very great points that you're making here. So my other question to you, because I see we have a few comments that we're going to want to go through. What are before we get to comments, what are the parents' rights if their child has been Baker acted?
A parent has the right to be notified that their child has been Baker Act. If they weren't with their child at the initiation of the process. This is very important. You have the right, the school, whomever. Like if you're not with your child at that moment, and your child is at school, the summer camp, I don't know, with a caretaker, babysitter, whomever, or at the hospital. You can be at the hospital and getting some type of treatment or whatever. If you are not there, you need to be notified immediately. what happened, what was done, why did he get or she got Baker Act, where is this going to be, the name of the place, address, and phone number. You can be there. I mean, arriving there even before the child's arrived. Who's making the baker at, who's receiving him, what's going to happen, what are they planning. I mean, you are the parent. You have the right to know everything about the whole process and participate in the whole process and to let them know, okay, this is what my child does. These are his triggers or her triggers. These are the things that help him or comfort him or make him feel safe. This is how he deals with things. It's very important to let them know. They can also be with their child when a physician is confirming that they meet criteria for a Baker Act. I can advocate if they feel their child does not meet eligibility. They can also share information about their medications, contact information of any mental health providers that the child is getting treatment from. That's very important. If the child is getting mental health, the psychiatrist, the mental health counselor that the child is seeing, it's very important to provide that information to the Baker Act facility. I mean, the Baker Act, to the crisis center or the hospital. They can also share tools like communication cards, social stories with the facility. Yeah, like what Olivia is showing. We're going to be sharing a link to a communication card that we have, that we are currently working on a social story about the Baker Act experience. Once we have finished that story, we will share a link in the comment section, so please check that later. How informed and prepared a facility is working with individuals with autism, that's going to vary. We, as CARD, we have worked with the Sarasota Memorial, St. Joe's Children's Hospital, Northside Behavioral Health Center, and Grace Point. And our goal is to help them to better serve people with autism. And also, we hope that we can continue to provide training to more mental health professionals. Again, not because someone is a mental health professional means that they know about autism or that they know how to better assist a person with autism. And that goes for pediatricians, psychiatrists, neurologists, mental health professionals, doctors. I mean, anyone.
Yeah. And I think sometimes too, it's just not, it's, because it's also kind of thinking of like, oh, we do this as part of our standard care and maybe not realize, oh, this could maybe trigger like a sensory issue. So it's those kinds of things too that we're trying to help better inform.
Correct.
Yeah. Do you have any advice for preventing the need for a Baker Act?
Yeah, there are a couple of things that can be done. Like I always tell my parents, it is very, very, very important. Like the same way that you're teaching your kids to brush their teeth, tie their shoes, put on their clothes, take a bath or a shower, and you are potty trained, and you are, on top of it, on top of it, on top of it. Let's include in that program expressing feelings. I mean, there's feelings chart. Just Google it. You Google feelings chart, and there's a variety. You just print it out, laminate it. If you can't, we are more than happy to do it for you. And let's work on that since they're little. It's very important for our kids to learn how to express their needs, what they feel, to put word into those feelings. And by word, I'm not saying just verbal, communication. It can be signs like ASL, American Sign Language. It can be with the card like Olivia showed, pointing at it, or with the feeling chart pointed at it, you know. And let's practice that. Let's practice. How do you feel? What make you feel like that? What can you do next time? And it's not you always telling. You participate by telling the child out of the blue moon, oh, mommy was sad, and you can show in the feelings chart sad. Okay. And why mommy was sad? Because mommy couldn't get the chocolate ice cream that she wanted. Okay. What do you think mommy can do so she can feel better? So let the child teach you, show you what can you do. Maybe he's going to bring you a blanket, because that's what he does when he feels sad. Oh, perfect. We practice that. It's not when you are in a severe depression, when you are in severe anxiety, when you are up to here, with a lot of sensory overload, that you're going to practice that. When we are very, very angry or very, very stressed out, I don't know about you, but I don't want anybody to tell me, so how do you feel? Let's talk about coping skills. Just leave me alone. So our kids is no different. But if that's part of me, that's part of my habit, I already know because we have been practicing it and it flows. Okay, it's already in me. So that's very important. Another important thing is stop the stigma and let's go and let's go to the mental health professional. The same way that we take our kids to the pediatrician just for a regular checkup, just to make sure that everything is okay. Nobody says anything, everything is perfectly fine, and there's no big deal about it. There's no big deal to go with a mental health professional. Not when the child is severely depressed, not when the child has a severe anxiety. Okay, let's go. Let's have a few sessions for 3 months or whatever, just a checkup, and then we stop, and then we go back and whatever. It's part of of the normality. So there's a difference between ABA and mental health. They are not the same. ABA is behavior. Mental health professional deals with depression, anxiety, and other mental health psychiatric, bipolar disorder, schizophrenia, or all others mental health conditions. So ABA doesn't go there. ABA is for behaviors, and together it's the perfect combination. Okay, but remember that our kids will express how they feel through their behaviors. So if you don't go to the core of the situation and you just deal with behavior, yeah, what you do is that, oh, now, he was hitting his head before. Perfect. He's not hitting his head before, anymore. But now he is, I don't know, eating something, or cutting or whatever. So he substitute the behavior because the core situation, the mental health, the feelings, the thought process, and all that, we haven't dealt with that. We just deal with the behavior. So it is also very important to think about how their words and action will be interpreted by those that are not familiar with autism. For example, you might show that your child will say, I'm going to kill you, because they are repeating something they have seen on TV, on a show, or something they heard from someone, or even from us. Sometimes we say, I'm about to kill her, and they are repeating that. But if they say that outside in a public place, they can get arrested because they're threatening a person, and your child with autism probably has no clue of the magnitude of what they're saying and the consequences of what they're saying. He's just repeating without having that awareness. We're going to show what it is, a safety plan. I think Olivia has one in there. The safety plan is something that mental health professionals we do, even though you can get this one online, and you can even print it out. And but it is preferred for the safety plan to be completed with a mental health professional if it's a minor. Most of the time the parents participate and sign also the safety plan as well, so the parents are aware of what was what it says in there, and what are the things that are going to be in place. Okay. If also important that there's some behaviors and words that the child says frequently that could possibly be misunderstood and trigger a Baker Act. It would be a good idea to discuss with your child's IEP team. There are things that could be done to access risk at school. A plan could be developed. It is very important that you let the every year, even if you can tell me, oh, but my child has been in the same school since he was in kindergarten. He's going to 10th grade. It doesn't matter. You go and you check with the social worker or the school counselor, the school principal, and the teacher or the teachers. Hey, this is how my child reacts. These are his triggers. These are his coping skills, and this is how what he does when he gets frustrated. He might say this and this and this and this, but this is what he means by it. Let them know, and please call me if he says any of those. Call me, okay? So you check with them and let them know and prepare them.
That's great that we're discussing this. We have a lot of questions and comments. So let's start going through those because we want to make sure we have time to answer some of them. So, Olivia, if you
I'll go through them. So,
on the same line.
So this one I can quickly answer. So the Marchman Act covers substance abuse, and the Baker Act is it's mental illness that is not related to substance abuse. So it's kind of like separate issues and separate areas that those two laws govern.
The ones that are sitting, go ahead and line them up. Yeah.
So
if your child is autistic, has an aggressive outburst at therapy, they should not be Baker at your child. What should be done instead? Well, it depends of how aggressive outburst. Again, if the aggression is in a point where his safety and or the safety of the therapist and the staff in the therapeutic place is in danger, they can be Baker Act. Again, Baker Act is going to be done when the safety of the person or the safety of somebody else is in line. It can be in danger. So then they can be Baker Act. But like aggressive behavior or aggressive outburst that the child is screaming, or running and screaming and whatever, that nobody's, it's scary, but
that's why the law specifies like the severity of like how much risk there has to be.
Yeah. And the mental health should be able to make an assessment and make the call, and or the supervisor of that mental health professional. She has a supervisor.
Okay. What else?
Teachers Baker Act. Do they go to a pediatric facility that is trained to work with autistic? No. There's the crisis center like Great Point and the one in St. Joseph. They have a unit, and in that unit, of course, they're not going to have a 17-year-old with a 6-year-old because that's illegal. They cannot do that, or a 25-year-old with a 13-year-old. That's not correct. But they classify it, like age ranges, and if they are trained to work with autistic children, like we said, that varies. There's some that are, there's some that are not. It is very important for the parents to advocate and to let them know, are you guys trained to work with people with autism? If not, we know about an agency that is more than happy to train you and all your staff about this. In the meantime, this is what my child needs. This is the way he communicates. These are his triggers. These are his coping skills. And this is what he means when he says X, Y, and Z. And you train them and be as involved as possible. I want to, if they have visits, twice a day or 3 times a day, I'm going to be there, visiting my child, that they see that you are involved in your child's treatment. And ask questions. What are you doing? How is he doing? Is he participating in therapy? How is he doing in therapy? Is he actively participating in therapy? What medications are you giving him? Why are you giving him that medication? What is it for? Ask questions.
Okay, next.
But a 72-hour hold will do more damage than good. So what is our option? It depends. Each case is very different. That's what the law states, 72 hours to keep the person. It gives professionals the opportunity to observe, and also for the person that has been Baker to have time to how would I say, to get back on track, if we can say it like that. No, and also if the child if the person is taking medication, for also the medications to start clicking in, and for therapy as well. So that's what the law states. Once the child is Baker Act, or the person is Baker Act, there's the 72 hours period, and that's how it is. Now, what are your option as a parent? Like I said before, advocate for your child. Let's ask for the staff to be trained, let them know we can train them, and talk to them and educate them about your child's specific needs, and also about what is autism, and be very involved.
Heather Gills also has a question about the ABA told them. Did you find that one?
ABA says we need something more intense than ABA, but fail to point us to what that would be. That I don't know, Heather. I don't know exactly where you're located at, but you are more than welcome to give us a call, and we can probably guide you a little bit better to your specific needs with your loved one with autism. Like give you more specific guidance. Mm-hmm.
Yeah, but the thing that comes to my mind also, maybe what they meant was some mental health treatments, maybe
Yeah,
beyond ABA, without knowing the case.
yeah.
And your first recommendation is the best, for so that we can guide better. But I would say that overall, if they're saying that ABA is not the thing, they're talking about behavior, then they need more. Then I would think that perhaps what they're trying, perhaps, I don't know, what they're trying to guide you to, even though they failed to tell you exactly what they meant, is probably maybe some mental component of it to treat the mental component, whether that is a combination of medication and treatment, or if he or she is already in medication, maybe to incorporate now the treatment component of it. So perhaps that's what they meant. But yeah, give us a call, and then we can be more specific with that based on the situation. Okay, awesome.
And just kind of a last comment here from Eric about, I think this is kind of piggybacking of what you were saying, Yasmin, as far as like identifying feelings that, being able to maybe self-advocate about like, I need this because it helps me to calm down, or things like that. I definitely think would definitely help situations.
That's very important. Like actually last week, my child and I know, actually Tuesday this week, my child asked me again, like, Mom, so I know I have autism, but what does that do to me? Like, what is it? And we talk about it, and the more she knows about who she is, and what is autism, and I explained to her the different levels, level 1, level 2, level 3, and what it means, what are the characteristics, and so they can advocate for themselves, so they know about themselves. Yeah, I have autism, This is what I do. This is what I need. This is how I do it, and this is the reason why I do it.
Mhm.
You know, and they and I know not only about autism. So we talk about all her other disabilities. Because it was like, what else do I have? Well, you have this, and what does that mean? Well, this is what it means. This is what it does, and this is why you do. This is the way you do. This is the way you behave, and this is why you need this. So they know, and they can talk to the people, and it's part of. It's still natural. You know, they're not ashamed about it. They're not embarrassed about it. That this is what I did. This is what it is, and this is what I do, and this is, you know, and they talk with this,
Yeah.
the most natural thing. Like, I have ADHD, I have autism, I have learning disabilities. This is how I learn. I can hold math on my mind. I learn it, and then 20 minutes later, I forgot about it.
Well, something I love is that there's a lot of conversation going on this. So just want to continue to encourage those of you who watch this after we get off the air. We're past our time, so we have to go. The conversation is super interesting. So thank you so much, Jasmine and Olivia for and our colleague Lee Daly for helping us bring this information to you, to the audience. She's so knowledgeable in this area as well. So, so I want to encourage you to keep leaving us your comments and questions in the section for comments, and we will try to answer you as we monitor those comments right there on the comment section. But if we do end up creating another program based on your comments or questions, we are always sure to give credit to those who gave us the idea of creating that programming. So go ahead and keep doing that, leaving us your messages. We thank you so much. We gotta go though, and we're past, but thank you for doing that. Also wanted to remind you that we continue to come to the air every 2 weeks. So the next time we're going to be on is going to be on the 30th of June. So be sure to join us at around 10:45-ish, because we do this same show. We do it in Spanish right before it. We start at 10 a.m. And so if you're bilingual or know someone who is Spanish speaking only, or know somebody who is bilingual, would like to listen to the same programming in both languages, go ahead and give them, share our information with them. In the meantime, I'm going to ask you for a favor, especially those of you who are very engaged with us. We're going to put a link in there for a survey. This is the way that we can justify the time that it takes us to put together this sort of material for you and to be on the air. So if you please can go in there and just get, it's 6 questions. It takes really a very short, real quick, grade us, give us a grade. Again, this is how we can stay in the air for you. All right. So please, thank you so much. Even if you've done it before, we need a new one for every one of this. So thank you so much. And that brings us to the end of the show. So thank you so much. We've got to go. We wish you a wonderful weekend. And but in the meantime, don't forget to give us a like, share this video and this page with all of those that you know who can benefit from this. And be sure again to reserve every other Friday to meet us here around 10:45-ish, so we can spill the beans on important topics related to autism. And until then, we want to wish you good vibes.
Good vibes and hot coffee.
See you next time. Bye-bye. Thank you for being engaged.